Hi everyone, my name is Norma Tamayo and I'm going to be talking about ADHD. So the definition for ADHD stands for Attention Deficit Hyperactivity Disorder. It's a neurodevelopmental disorder, which means it affects how your brain develops. Despite its name, ADHD doesn't mean that you lack attention. It just means that it's harder for you to control your attention or direct it to certain tasks. Signs and symptoms. ADHD symptoms fall into three types of presentations. Inattention symptoms affect your ability to focus on tasks and complete it from start to finish. You might put off tasks that require focusing. You may also seem distracted when someone's talking to you, and you may lose things a lot. Other signs include not paying attention to details or making seemingly careless mistakes, forgets to do things they're supposed to, is easily distracted by things going on around them, sometimes even their own thoughts, and has a difficulty with organization. Hyperactivity, impulsivity symptoms affect your ability to sit still or feel comfortable staying in one place. You may also have trouble waiting for your turn to speak or do something. Other symptoms include fidgets, hard time doing tasks quietly, interrupts what others are doing, feels restless when they're supposed to stay in one place, seems like they're always on the go, and talks more than expected. And lastly, a combined presentation, a combination of inattentive and hyper-impulsive symptoms. Cause and risk factors. The exact cause of ADHD is not clear, but research efforts continue. Factors that may be involved in the development of ADHD include genetics, the environment, or central nervous system conditions at key moments in development. Risk factors include blood relatives, such as parents or siblings with ADHD or another mental health condition. Being around environmental toxins such as lead, found mainly in paint and pipes in old buildings, recreational drugs, alcohol, or tobacco use during pregnancy, and premature birth can all enhance the risk for ADHD. Prognosis. Symptoms start in childhood and often last into adulthood. ADHD doesn't progress, however, symptoms can become more severe in terms of managing adult tasks. Children show hyperactivity and impulsivity as the most common symptoms. Demonstrates interference in academic performance and peer relationship. Adolescents typically show less hyperactivity and can appear as restless or fidgeting. They show academic, organizational, and relationship challenges and impulsive, risky behaviors. Adults, including older adults, can show inattention, restlessness, and impulsivity. In some adults, symptoms become less severe and less impairing. Other signs include irritability and intense mood changes. Treatment can lessen many of the symptoms of ADHD, but they do not cure it. The types of treatment include psychotherapy, medication, life ADHD coaches, and lifestyle changes. Demographics. ADHD is one of the most common neurodevelopment disorders of childhood, according to National Service parents using data from 2022. Boys were more likely to be diagnosed with ADHD than girls between the ages of 5 through 11 and 12 through 17 years old. Black children and white children were more often diagnosed with ADHD than Asian children. American Indian Alaskan Native children were more often diagnosed with ADHD than Asian children. 6% of Native Hawaiian Pacific Islander children were estimated to be diagnosed with ADHD. Non-Hispanic children were diagnosed with ADHD more often than Hispanic children. And here are two data sets. Prevalence of children ages 5 to 17 years ever diagnosed with attention deficit hyperactivity disorder by age groups and sex in the United States, 2020 to 2022. And prevalence based on socioeconomics. Prevalence of ADHD decreased as family income poverty levels increased. Barriers and accommodations. Executive dysfunction made goal-oriented planned behavior challenging. In addition, people with ADHD also have difficulty with time management, experiencing time blindness. Reasonable accommodations include breaking down instructions into smaller steps with visual aids, assigning a staff member or a volunteer to provide one on one support or check ins, and visual schedules or timer to help with transition. Community resources. Children and adults with attention deficit hyperactivity disorder, or CHAD. And here is the website: the nation's leading nonprofit organization serving people affected by ADHD. Their services offer e learning programs, advocacy, local support groups, and searchable resources library, and other resources for parents, educators, and adults with ADHD. And there is also the City of Davis Adaptive Recreation Program, and the website for that is right underneath, which is a local resource offering activities for individuals with development disabilities. Adaptive recreation is a program designed for adults with developmental disability. The City of Davis offers both inclusive and separate recreational activities to ensure that the community members have choices. For those who are diagnosed with ADHD, this is a great program to join, which allows participants to request accommodations as needed, whether it's time, flexibility, or extra breakdown of instructions through the city's registration system and accommodation policy. And this is their logos to the right. Facts about ADHD. Many adults with ADHD aren't aware that they have it. Brain injuries, nutrition, and social environments can be risk factors to development of ADHD. A majority of adults taking stimulant medication reported difficulty getting their prescriptions filled due to lack of availability. In 2022, an additional 1 million U.S. children ages 3 through 17 years had ever received an ADHD diagnosis compared to 2016. 78% children with ADHD had at least one other co-occurring condition, including depression, autism spectrum disorder, and Tourette's syndrome. Personal career connection. Learning about ADHD is important for someone who is pursuing a nursing career, not only because it is a health condition medical staff should be aware of, but also because it is among some of the most common conditions that many adults are unaware they have. Learning about ADHD provides nurses with the clinical skills to provide compassionate and effective care to patients with the disorder. As a nurse, you should be able to assess a patient, observe behaviors to help determine if a patient has ADHD, to begin coordinating a potential care plan, and to take time to educate patients and their families about ADHD. And this is my sources, and that completes my presentation. Thank you.